This issue's been since January 15th. I wish I could get back to golf as soon as possible. However, the pain is not going to let me do it.
What's going on?
Well, about 2 weeks after Christmas, somewhere around maybe the 15th of January, I was playing golf. Mm-hmm. Hitting the ball great. Got home, I only played 9 holes. Got home, and then the next day we were actually taking down the decorations, and it started hurting and hurting more down my leg, and I was having trouble going up and down the ladder. So, you know me, I put up with it for a while, and then finally I went and saw my doctor, and he said, we need to get an x-ray. That's the one we just had sent you.
Yes,
yeah. So then I went to see Pablo over at White Tanks, which is therapy.
Yeah, great guy, Pablo. Yeah.
So now, I wasn't able to bend down or anything without that pain. And I mean, it's crippling almost.
Now, you're pointing to your left side.
Yeah, mainly from the left. And it would start right down in the lower back, right down my leg, down to my knee. And I mean, it would just fold me over. So
outside of the knee or crossing over to the inside?
No, it's on the outside.
On the outside.
On the outside.
And did it ever go down below the knee into the foot?
No, never went down below the knee or in the foot.
Any numbness or weakness in the foot, the ankle, or the leg?
The only thing with my feet is I had cancer. You didn't know that.
I don't remember that. Yeah.
No, so I had multiple myeloma.
Oh.
Okay.
Oh, multiple myeloma. Okay.
Yeah. So of course I was on chemo
transplant.
and a stem cell transplant over at Mayo. So needless to say, with chemo, you end up with neuropathy in your feet.
Right.
So I'm falling apart.
When you golf,
Yeah.
do you play with a cart or do you walk?
I play with a cart.
How much? So you're still doing some walking?
Yeah.
Out on the green?
Yeah.
Do you ever get pain that shoots from your back down both legs like electricity?
No.
Relieved by bending?
No, actually not.
Nothing like that?
Nothing like
This
that.
is a left-sided pain that goes onto the outside of your thigh.
Yep.
Feels like it's in your hip?
It feels like it's in the hip, but I also feel it in my back. And
You
the
also,
lower back.
you know it's coming from the back,
Yeah,
right,
yeah.
right. Besides the myeloma and the neuropathy,
Yeah.
other than that, Mrs. Lincoln, how was the play?
Doing fine.
The heart's fine,
Yeah.
the lungs are fine.
Yeah.
No new diabetes, nothing else.
No,
Everything else
never
is
had
okay.
diabetes, but
Yeah.
but no, everything else has been
You're all
very,
good.
very good.
Okay.
I was just still go to the cardiologist, and he said I don't need to see you for a year and stuff like that. And
Right. Well, you want to look at the MRI?
love to, love
Take
to.
a look. Okay, so you saw that narrowing right there.
Yep.
And then here's the perpendicular. The screws at the level above look great. The spinal canal looks great, but the level below is quite narrowed. And then as we look at that level below, we see this. See that white stripe there? Mm-hmm. That is on the left side. This one is on the right side. Mm-hmm. That stripe is a normal structure. That stripe is inside the joint of the spine there at that level, and that is a swollen joint.
Okay.
If you have a swollen, do you know what the joints of the spine are called by any chance? Nobody does. I don't know why. Like, what joint is this?
It's your
wrist
It's your wrist.
Yeah.
That's literally your wrist.
Yeah.
What's that?
Elbow.
Elbow. But the joint of the spine is the...
Spine.
Right. It's not. It's called the facet joint. I don't know why nobody knows about the poor facet joints. They're working so hard and they get no credit. They're the best, the hardest working, least credited joints in history.
There you go. There you go.
Well, these facet joints, facet like the facet of a diamond, like the surface. These facet joints are when they get swollen and they hurt like any other joint in the body. And when they do, you get an ache in your back, a pain in the back that shoots into your butt. It feels for all the world like it's in your hip. And then you get this weird burning on the outer part of your thigh. Does that sound like anyone you know?
Yeah, yeah. It sounds like me.
It's you. Yeah. The narrowing of the spinal canal, which is what doctors call spinal stenosis, that and you have that on the MRI, but a lot of times people have it and they don't even know they have it. Spinal stenosis causes pain that shoots down both legs. It's not really back pain, it's a shooting pain. It doesn't go into the hip, and it's relieved by bending or resting, which is not what you have.
No.
You have joint pain, facet joint mediated back pain. So you have an arthropathy, you have arthritis of the spine, and that's what's causing your pain.
So how do we fix it?
It's actually super easy to fix.
Okay.
Yeah, I like that answer.
Yeah, so there's a little nerve which goes to each joint, which is, since it's the facet joint, it's called the medial dorsal branch of the primary ramus, but you could call it the facet branch.
Okay.
And it's not much bigger than a human hair, so very thin. It goes into that joint, and if you have pain in the joint, it activates that fiber, and then the message goes all the way back up to your brain. So if you were to put a numbing medicine around that branch and inject the numbing, the pain should go away until the numbing wears off, which takes as long as the numbing. If you've been to the dentist, sometimes it's an hour, sometimes it's 4 hours, depending on what they use.
Yeah.
So if they use a 4-hour medicine and you get 4 hours of back pain relief, and then the pain comes back, then you would know for sure that what I think is true based on your symptoms is that's the test that would prove it's true. That injection is called a medial branch block. Medial branch block.
Okay.
Remember how the technical name is the medial dorsal branch of the primary ramus? Medial branch block is a test. If you pass the test, then they put in an electrode and they fry the nerve. It doesn't cut it, it doesn't break it, but it disrupts it, usually for about 10 months. And during that 10 months, you get total relief of this pain.
But then what happens after 10 months?
Comes back and you do it again. If it doesn't work, you can consider other procedures when it comes back, and it is coming back. The other procedures are DVR, direct visualized rhizotomy, where they go in with a scope and cut that fiber, or fusion, where you have, like you had at the level above, you have at this level, much bigger surgery. But these other things are worth a try because it's literally a shot. I mean, it's not even surgery, so. It would normally people would want to try that out first.
Okay. But you're not, that long-term thing is you're not doing any more damage to that area?
No.
Okay.
There is a little bit of damage that happens day to day, and a lot of people say, well, wait a minute, if I can't feel it, aren't I going to do more damage? As a practical matter, that's theoretically true, but as a practical matter, we're not trying out for the Olympics. It's no. You can't do.
Steve doesn't run anymore.
Well, I would recommend this course of treatment for you. Now, what about the spinal stenosis? It's still in there. It never gets better. It only gets worse, but it often gets worse so slowly, glacially slowly. This MRI is worse than the one you had previously, so it is progressing. But it could be that, it won't even affect you during this lifetime. It could be that it will, but it's something to keep an eye on. But those other symptoms, pain going down the legs when you walk, relieved by bending, that's what you would want to watch out for. And then there are some other things that can happen when your nerves get squished. You can lose control of the bladder, but that is just at the very end stage of this thing. Usually you have to have critical stenosis, and it doesn't happen overnight. What you notice is you start having to where when you empty, it doesn't empty all the way, and you have to go pee again and again and again. If we weren't sure, we would get a urologist to do what they call Eurodynamic Testing.
Yep.
So there's a whole dimension to that, but based on your symptoms, you don't have, although you have stenosis on the MRI, your symptoms sound like facet-mediated back pain, and so this other course of treatment is what I would recommend first.
Cool. I thought I was going to go underneath the knife again.
Can I ask a favor? Can you write that down?
Yes, I will. Well, I'll recommend you one even better. I'll send you to, so the doctors who do this diagnostic medial branch block are called pain management physicians. I would recommend that you go see, and I'll recommend a pain management physician to you.
The one thing that I've noticed since I've been working with Pablo, the pain has really been very, very good compared to what it was before. But when I'm walking, I can feel like a shifting.
Yeah.
Is that normal? That I mean, it
Yeah.
feels like the whole thing is just going like this. Is that possible?
No,
Okay.
your spine is not moving abnormally, or you would be on the ground in pain.
Okay.
Yeah, so no. But there is a lot. You have, you're a nice guy with a lousy back, and you've got abnormal dynamics that your body has to compensate for. Mm-hmm. And what you feel are the other things moving around to make room for your back, which is not really flexing the way that it did when you were a young man. That's okay.
We're okay.
Yeah, you're okay. Stuff changes, but we're still fine.
Okay.
So at what point will he be able to golf?
He could golf today. He's not going to damage
anything? Okay.
He's not going to damage himself by golfing. It might hurt, which would be a stop sign. But you could certainly chip and putt and practice and mess around. And then I would get the treatment if you're feeling good. Talk to Dr. Fox about getting him back to golf.
Sure.
And get out there. But that's a great goal, and there's no reason why you can't do that. But just to be clear, you might harm yourself with pain, but you're not damaging your nerves by golfing.
Okay.
So,
Interesting.
yeah.
I would have thought I would have been damaging it, so I haven't done it. I mean,
Yeah.
I just stopped doing it. So.
All right.
Hey,
Good to see you guys.
Good seeing
Yeah.
you again
Yeah,
too.
great to see you.
Thank you very much.